Okay, let's dive into this. Kidney stones. It's a topic many of us might, well, cringe at,
Yeah,
right?
and for good reason. It's surprisingly common.
And intensely painful. I mean, the numbers are pretty staggering. Over 500,000 people hit the emergency room each year for kidney stone problems.
That's right. And think about this. 1 in 10 people will have a kidney stone sometime in their life.
1 in 10.
Wow.
Wow. And it makes sense. Our urinary tract just isn't really built to pass solid stuff.
Exactly. So, no surprise, it's agonizing. But beyond just the pain, there's a lot we can talk about regarding prevention and control.
That's what I find interesting.
Yeah, what's fascinating here is just how much control or agency we might actually have over preventing them through lifestyle,
Mm-hmm.
but, also recognizing when medical help is absolutely crucial.
Right. So our mission today for this deep dive is basically to give you a shortcut.
Hmm.
Get you well informed about kidney stones,
Yep.
what they are, what causes them,
Yeah.
how you might prevent them, lifestyle stuff, and then the medical and surgical options out there. Okay, so let's start at square one. What exactly is a kidney stone? Like fundamentally?
Well, fundamentally, it's a hard object. It forms from chemicals that are normally found in your urine.
Chemicals like?
Things like calcium, oxalate, urate, sometimes cysteine, xanthine, phosphate. Basically, when there's too much of this waste material
Uh-huh.
and not enough liquid to dissolve it all, these chemicals can crystallize. Then they clump together.
Like little crystals sticking together.
Exactly, forming a solid mass, a stone.
And these can be tiny or pretty big, right? I mean, what kind of range are we talking about?
Oh, the range is dramatic.
Right.
Really dramatic. They can be as small as a grain of sand. You might not even notice passing one that small.
Okay.
Or they can grow, sometimes as large as a golf ball.
The golf ball, seriously.
Seriously. Now, you're very unlikely to pass that naturally, thankfully, but it shows the potential size.
Yeah, definitely. And what do they look like?
Typically yellow or brown. And the texture varies, too. Some are smooth, others can be quite jagged.
Ouch. Jagged sounds particularly unpleasant.
It can be, yeah.
Now, it feels like we hear about kidney stones more often these days. Is that just me, or is it actually becoming more common?
No, it's not just you. The data absolutely backs that up. The prevalence, the number of people with kidney stones in the U.S., it's more than doubled.
Doubled. Since when?
Well, comparing the late 1970s, when it was about 3.8%, to around 2013, 2014, where it hit 10%.
Wow, from under 4% to 10%.
Yeah.
That's a huge jump.
It is. And there's a gender difference, too. Men have a higher risk, around 11%, compared to about 6% for women.
Interesting. So it's definitely a trend worth paying attention to.
Absolutely.
Okay, so if they're formed from different chemicals, I'm guessing not all stones are the same, or they're different types?
Exactly. There are several main types, and knowing the type is really important for prevention.
Makes sense. What's the most common one?
The most common type by far is calcium oxalate. That's formed when calcium combines with oxalate in the urine.
Calcium and oxalate.
Okay. Yeah. And this type is often linked to things like having low citrate levels in your urine or high levels of calcium, oxalate, or maybe even uric acid.
Uh-huh. And diet plays a role here.
Definitely. Certain foods are higher in oxalate, things like beets, black tea, chocolate, nuts, potatoes, spinach.
So does that mean you have to avoid those foods completely if you're prone to these?
Not necessarily avoid, but be mindful. And crucially, sometimes it's about how you eat them. We'll get into that more later, like pairing them with calcium.
Okay, interesting. So calcium oxalate is number one. What's next?
Next up is uric acid stones. These are also pretty common.
Uric acid, like in gout.
Exactly like in gout. They're strongly linked to diets high in animal proteins, specifically compounds called purines that your body breaks down into uric acid.
Ah, okay. So lots of meat could be a factor.
It can be. Dehydration is another big factor for uric acid stones, and they can also run in families. They tend to be more common in men, too.
Got it. What else?
Then there are struvite stones. These are less common, thankfully,
Why, I think.
because they're caused by certain types of urinary tract infections, UTIs, and they can grow really quickly, sometimes getting very large, almost filling the kidney. They call them staghorn calculi sometimes.
Staghorn. Wow. That sounds serious.
It is. They're more common in women because women tend to get more UTIs.
Right.
And if you don't treat them, they can cause frequent infections and even lead to kidney damage or loss of function.
Okay, definitely want to avoid those. Are there any rarer types?
Yes, a couple more. Cysteine stones are rare. They're caused by a genetic disorder, it's hereditary, called cystinuria. Basically, too much of an amino acid called cysteine gets into the urine.
So that's purely genetic.
Pretty much, yeah.
Okay.
And finally, there are calcium phosphate stones. These are often linked to problems with how the urinary system functions, maybe how acidic the urine is, and they often show up alongside calcium oxalate stones.
Right. So knowing the type is key.
Absolutely critical. It guides everything from prevention strategies to treatment choices.
Okay, so let's talk about symptoms. The big one everyone knows is pain. Can you describe that a bit more? What's it actually like?
The pain is, well, it's notorious for a reason. It's often described as severe, really severe. It can come in waves, kind of building up, easing off slightly, then coming back with a vengeance.
Where do you feel it usually?
Typically, it starts in your side, kind of the flank area or your lower back, usually on one side, but sometimes it can feel more like a vague stomachache that just won't go away.
And what's actually causing that intense pain? Is it the stone itself scratching?
It's usually less about scratching and more about blockage. The pain really kicks in when the stone starts to move down the ureter, that narrow tube connecting the kidney to the bladder, and causes irritation, or, more likely, blocks the flow of urine.
Ah, so it's pressure building up behind the stone.
Exactly. That pressure and stretching of the kidney or ureter is what causes that extreme pain.
Got it. Are there other symptoms besides pain?
Oh, yes. Changes in your urine are common. You might see blood, making it look red, pinkish, or sometimes brown. The urine might also be cloudy or have a foul smell, especially if there is an infection. Nausea and vomiting often go along with the intense pain.
That sounds awful.
It is. And sometimes, if an infection develops because of the blockage, you might get fever and chills too.
So the pain is bad. Sounds like it can be unbearable. You mentioned most stones pass eventually.
They often do, yes, especially smaller ones. But usually, as the saying goes, not without causing a lot of pain.
Right. So when does it cross the line from, this is awful, I need painkillers, to, this is an emergency, I need to go to the hospital now? What are the absolute red flags?
Okay, this is really critical. You need immediate medical attention, like emergency room, if you have that severe pain plus vomiting that you can't control, or a fever or chills.
Got it. Pain with vomiting, fever, or chills, always ER.
Definitely. Also, if you see bright red blood in your urine, or if the amount of blood seems to be increasing, or, and this is a big one, if you find you're having difficulty urinating at all, like you feel you have to go but nothing comes out.
Blockade.
Right, that's a sign of a serious blockage. And one more thing, if you've recently had kidney stone surgery, watch out for heavy bleeding in any drainage tube, pain getting worse instead of better, nausea lasting for days, signs of infection around the cut like swelling or redness, or systemic symptoms like dizziness, chest pain, or shortness of breath.
Okay, those are clear warning signs. And what's the danger if someone tries to tough it out, ignores those signs? What could happen?
The stakes are really, really high. An untreated blocked ureter can lead to a severe kidney infection. That infection can spread into the bloodstream sepsis, which is life-threatening.
Wow.
Beyond infection, if the kidney stays blocked for too long, it can cause permanent damage, chronic kidney disease, or even complete kidney failure on that side. So ignoring those urgent signs is incredibly risky.
That definitely puts in perspective. Okay, so let's shift gears a bit and talk about why. Why did these stones form in the first place? We touched on chemicals, but what are the underlying causes and risk factors? I heard there's some interesting research linking lifestyle.
Absolutely. There was a significant study looking at the impact of lifestyle factors on the development of kidney stones, and it found some really strong connections.
Like what?
Well, for instance, a high intake of animal protein. The study found an odds ratio of 3.88 associated with it.
Okay, hold on. Odds ratio, can you break that down for us? What does 3.88 mean here?
Good question. So, an odds ratio basically tells you how much more likely someone with that risk factor is to have the condition compared to someone without it. So, an odds ratio of 3.88 means people with a high animal protein intake were nearly 4 times more likely to develop kidney stones.
4 times, just from eating a lot of animal protein. That's huge.
It's a very strong link, yeah. It really highlights the dietary impact.
What else did the study find?
High sodium intake also showed a significant risk, with an odds ratio of 1.98, almost double the risk.
Salt, okay.
High oxalate intake, which we mentioned earlier, had an odds ratio of 1.65, and having a higher body mass index, or BMI being overweight or obese, was strongly linked to, odds ratio of 2.33.
So weight matters quite a bit.
It does. Interestingly, the study also found a link with lower socioeconomic level, an odds ratio of 1.75. Maybe related to dietary patterns or access to healthcare, it's hard to say exactly why from just that number.
Right. Were there any protective factors, things that lowered the risk?
Yes, thankfully. High physical activity and perhaps unsurprisingly, adequate hydration were both shown to be protective. They lowered the odds of developing stones.
Okay, so those statistics really paint a picture, don't they? It feels less like random bad luck and more like something influenced by our choices.
To a large extent, yes. Though genetics and other factors play a role too, lifestyle is a major piece of the puzzle.
So besides those big ones from the study, what other factors contribute? You mentioned hydration being protective, so not drinking enough water.
That's probably the single biggest, most common risk factor. Drinking too little water is a primary driver for both forming stones in the first place and for having them come back.
Makes sense. More concentrated urine, easier for crystals to form.
Exactly. And diet beyond just protein and oxalate things like too much salt, as we saw, but also too much added sugar, especially high fructose corn syrup. That's a big one.
High fructose corn syrup, like in sodas.
Yep. And speaking of sodas, cola drinks are often high in phosphate, which can also promote certain types of stones.
Interesting. What about specific diets, like high-protein weight loss diets?
Those can definitely increase risk, especially if they're heavy on animal protein because of the uric acid connection we talked about.
Right, and weight itself.
Yes, being overweight is a clear risk factor.
Mhm.
Losing weight can be particularly helpful for people prone to uric acid stones.
Activity level. You said high activity was protective, but can too much or too little be bad?
It's a bit of a Goldilocks situation. Too little activity, being sedentary, is a risk factor. But sometimes very extreme endurance exercise without adequate hydration could potentially pose a risk too, though regular moderate activity is definitely beneficial.
Okay. What about medical conditions?
Several conditions increase risk. Obviously, recurring UTIs for struvite stones, gout for uric acid stones. Things like inflammatory bowel disease can affect nutrient absorption and increase risk. Cystic kidney diseases, and a condition called hyperparathyroidism.
Hyperparathyroidism.
Yeah, it's where your parathyroid glands, little glands in your neck, go into overdrive and make your body release too much calcium into the blood and urine. That's a direct cause of calcium stones.
Ah, okay. Does family history play a role?
Yes, definitely. If you have close relatives with kidney stones, your risk is significantly higher for several types. There's a clear genetic component for some people.
And medications. Can drugs cause kidney stones?
They can. Certain diuretics or water pills sometimes used for blood pressure. Some calcium-based antacids if taken in excess. Specific drugs like Indomir, used for HIV, or topiramate, used for seizures and migraines. It's always important your doctor knows all the medications and supplements you're taking.
Good point. And lastly, any demographic factors for recurrence? Like who's more likely to get them again?
Yeah, unfortunately, some factors increase the chance of recurrence. Getting your first stone at a younger age is one. Being Caucasian, being male, hypertension, high blood pressure, and again, family history and being overweight.
So it's a complex mix of lifestyle, genetics, medical conditions.
Ah.
It can feel a bit overwhelming.
It can seem that way.
But let's focus on the positive, on prevention. If someone wants to take control, reduce their risk, where should they start? What are the most impactful things they can do?
The absolute number one, the cornerstone of prevention, is hydration. I really can't stress this enough.
Drink more water. How much are we talking?
The goal is to produce about 2 liters of urine per day. For most people, that means drinking more than 12 glasses of water a day. Maybe even more if you exercise a lot or live in a hot climate.
12 glasses. Okay. That's quite a bit.
It is, but it makes a huge difference. A good visual guide is the color of your urine. You want it to be consistently very light, pale yellow.
Pale yellow, got it.
Yeah.
And is water the best, or do other fluids count?
Water is definitely the best. Sodas, especially colas, sports drinks, even too much coffee or tea might not be as helpful, or could even be counterproductive for some people, depending on the stone type. Stick with water primarily.
Okay, hydration first. What about diet? Any general dietary strategies?
Well, the DSH diet, dietary approaches to stop hypertension, has actually been shown in studies to reduce kidney stone risk, too. It emphasizes fruits, vegetables, whole grains, lean protein, low-fat dairy.
The DSH diet. Interesting. And sodium.
Reducing sodium is huge. Aim for less than 2,300 milligrams a day. If you've had stones before, especially calcium stones, your doctor might recommend aiming even lower, maybe 1,500 milligrams.
That means reading labels carefully, right? Sodium hides everywhere.
Absolutely. It's not just a salt shaker. It's in processed foods, canned soups, deli meats, condiments. Look for things like sodium bicarbonate, MSG, baking soda on labels too.
Good tips. And the animal protein link. What's the advice there?
Limiting animal protein can help, especially for uric acid and some calcium stones. Think about replacing some servings of beef, pork, chicken, eggs, fish, dairy with plant-based proteins.
Like what?
Things like beans, lentils, dried peas, tofu, tempehs, nuts, seeds. Eating more fruits and vegetables also helps make your urine less acidic, which is generally good for preventing most types of stones.
Okay. Now, for the most common type, calcium oxalate stones. Managing oxalate. You mentioned pairing high oxalate foods with calcium.
Exactly. This is a really important point. If you're prone to calcium oxalate stones, you might need to be mindful of high oxalate foods like spinach, rhubarb, nuts, chocolate, beets, sweet potatoes, wheat bran.
Right.
But instead of just cutting them out, if you eat them, have them with something rich in calcium at the same meal, like spinach salad with some cheese or nuts with yogurt.
How does that help?
The calcium binds with the oxalate in your stomach and intestines before it gets absorbed into your bloodstream and reaches your kidneys. So less oxalate gets into your urine to form stones.
That's clever. So calcium's actually protective here. That seems weird given their calcium oxalate stones.
It does seem counterintuitive, but it's true. Getting enough calcium from your food is crucial for prevention. It helps block stone formation. We're talking about calcium from dairy, fortified foods, leafy greens.
So food sources are good. What about calcium supplements?
That's the key difference. Calcium supplements have actually been linked to an increased risk of stones in some studies. So get your calcium from food, not pills, unless your doctor specifically tells you otherwise.
Very important distinction. Okay. Any other dietary power players?
Citrus fruits. Lemons, oranges, grapefruit, they contain citrate.
Citrate, you mentioned that earlier.
Yep. Citrate is a natural inhibitor of calcium stone formation, so adding fresh lemon juice to your water, for example, can be beneficial. In higher pharmacological doses, citrate medication can even help dissolve certain stones.
Wow. And sugars.
Limit added sugars. Definitely cut back on sucrose and especially high fructose corn syrup. Check labels on processed foods, drinks, juices. Those contribute to risk.
Okay. That's a lot of solid dietary advice. Now, what about all those home remedies you hear about, like apple cider vinegar, cranberry juice, things like that? Do any of them actually work?
That's a really common question, and it's where we need to be cautious. Some traditional remedies might have a basis in science, like lemon juice providing citrate,
Uh-huh.
but for many others, the evidence for actually treating or dissolving existing stones is weak or just not there in humans.
Huh.
Apple cider vinegar, for example, contains acetic acid, which might help prevent stones, maybe ease some pain.
Oh, yeah.
But there's no good evidence it dissolves stones that are already formed.
Yeah.
And it has risks. It can damage tooth enamel, worsen acid reflux, interact with medications like insulin or diuretics. You shouldn't overdo it. Maybe 1 glass diluted in water a day, max.
Right. What about others? Basil juice? Celery? Pomegranate?
Similar story for many. Basil has antioxidants, might support kidney function based on some animal studies, but human data is lacking. Celery juice, same thing, traditional use, some rat studies, needs human research. Pomegranate juice has antioxidants, but the National Kidney Foundation says it doesn't really affect stone prevention and it can interact with cholesterol meds.
So mostly lacking strong human evidence.
Exactly. Kidney bean broth is traditional, but little evidence. Dandelion might increase urine output, maybe helps prevent crystals in lab studies, but again, needs human trials and has potential interactions and side effects. Wheatgrass juice, same deal, might inhibit crystals, not shown to break down formed stones, can cause nausea. Horsetail is a diuretic, but the NKF advises against it for people with kidney disease, and it has side effects.
It sounds like a minefield of potential interactions and unknown effects.
It can be, which really raises a crucial point.
What's the bottom line safety advice here?
Always talk to your doctor before trying any home remedy, herbal remedy, or supplement for kidney stones. Seriously. Many aren't regulated by the FDA for quality or purity. What helps one stone type might harm another. Your doctor needs to weigh the potential benefits against the risks for you specifically.
Okay, that's critical advice. And drink water afterwards.
Yes. Always drink a full glass of water right after any flavored remedy to help flush it through and protect your teeth.
Good tip. Okay, so prevention is key, but sometimes stones happen anyway, or they're too big. How do doctors figure out what's going on? How are stones diagnosed?
Diagnosis usually starts with your symptoms and medical history, then a physical exam. But imaging is really key to see the stone.
What kind of imaging?
High-resolution CT scans are often the preferred method now because they're very detailed and can see almost all types and sizes of stones and check for blockages.
Okay.
Sometimes a specific type of X-ray called a KUB, kidney, ureter, bladder, might be used, or an old test called an intravenous pyelogram, IVP, where they inject dye. But CT is generally favored.
And blood or urine tests?
Absolutely. Blood tests check your kidney function and levels of things like calcium and uric acid. Urine tests look for blood, signs of infection, and crystals.
And analyzing the stone itself?
Yes. If you pass a stone, or if one is removed surgically, they'll send it to a lab. Analyzing its composition, knowing if it's calcium oxalate, uric acid, etc., is incredibly important for figuring out why you formed it and how to prevent more in the future. Sometimes they'll also do a 24-hour urine collection.
What's it involve?
You collect all your urine over a full 24-hour period. The lab then analyzes it for volumes, levels of calcium, oxalate citrate, uric acid, sodium, and other things to get a really detailed picture of your personal risk factors.
Okay, comprehensive diagnosis. Now, what about treatment? If it's a small stone, what's the plan?
For smaller stones that seem likely to pass on their own, the mainstays are, again, hydration, drinking lots of water to help flush it out.
And pain relief.
Yes. Over-the-counter pain relievers like acetaminophen, Tylenol, ibuprofen, Advil, Motrin, or naproxen, Alev can help manage mild to moderate pain. If the pain is severe, your doctor might prescribe stronger pain medication.
Any other medications?
Sometimes, depending on the stone type and urine chemistry, they might prescribe medication to help make the urine less acidic or more alkaline, or to decrease levels of stone-forming substances. Alpha blockers like tamsulosin are also sometimes used to relax the ureter and help the stone pass more easily.
Okay, that's for smaller stones. When does surgery become necessary?
Surgery is generally considered if the stone is just too big to pass naturally, or if it's causing really severe, unrelenting pain that can't be managed. Also, if it's causing a significant blockage that's harming the kidney, or if it's leading to repeated urinary tract infections.
Makes sense. So what are the surgical options?
There are a few main procedures ranging from non-invasive to more involved. The most common one is shock wave lithotripsy, or SWL.
Shock waves. How does that work?
It uses focused, high-energy sound waves generated outside the body. These waves pass through your skin and tissue and converge on the stone, breaking it into smaller fragments like sand that you can then pass in your urine.
Is it painful? Do you need anesthesia?
It can be uncomfortable, so you usually get some form of sedation or light anesthesia. It typically targets small to medium stones, usually less than 2 centimeters.
Okay. How long does it take? Recovery.
The procedure itself is often about an hour. Usually you go home the same day. Recovery is pretty quick, maybe 1-2 days of taking it easy.
Any downsides or risks?
There can be some side effects like cramping or blood in the urine as the fragments pass. Less commonly, there can be bleeding around the kidney, infection, or damage to the kidney. And sometimes, not all the fragments break up or pass, so you might need another treatment.
Okay. SWL is one option. What's another?
Another very common one is ureteroscopy.
Ureteroscopy. Telescope in the ureter.
Exactly. A very thin, flexible, or semi-rigid scope with a camera is passed through your urethra into the bladder and up the ureter to where the stone is. No cuts involved.
And then what?
If the stone is small enough, the surgeon can grab it with a tiny basket device and pull it out. If it's a bit larger, they can use a laser pass through the scope to break the stone into pieces, which are then removed or allowed to pass.
When is this used? Recovery.
It's great for small to medium stones, especially ones lower down in the ureter that SWL might not reach well. Again, usually same-day discharge. Recovery might take a little longer, maybe 5-7 days.
Any specific things after ureteroscopy?
Often, the surgeon will place a temporary stent, a thin plastic tube, inside the ureter after the procedure.
A stent. Why?
It helps keep the ureter open and allows urine to drain easily while any swelling goes down. It's usually removed after about 4 to 10 days, sometimes in the doctor's office. Sometimes you can even remove it yourself at home with a string attached.
Wow. Risks with ureteroscopy.
Risks include infection, bleeding, or potential injury or scarring causing narrowing of the ureter, though that's uncommon with experienced surgeons.
Okay. What if the stone is really big or those methods don't work?
Then the next step up is usually percutaneous nephrolithotomy, or PCNL. Percutaneous means through the skin.
So this involves an incision.
Yes, but usually a small one, maybe less than an inch, in your back or side. A tunnel is created directly into the kidney.
Directly into the kidney.
Yep. A scope called a nephroscope is inserted through this tunnel. The surgeon can then directly see the stone and either remove it whole, that's the nephrolithotomy part, or use instruments like lasers or ultrasonic probes to break it up and suction out the pieces. That's nephrolithotripsy.
When is PCNL the choice?
It's typically for larger stones, like those bigger than 2 centimeters, or complex stones like those staghorn ones we mentioned, or if SWL or ureteroscopy hasn't worked.
This sounds more involved. Hospital stay. Recovery.
It is more invasive, yes. It usually requires a short hospital stay, maybe 1 or 2 nights. Full recovery takes longer, maybe 2 to 3 weeks.
Risks.
Risks are a bit higher than with SWL or ureteroscopy. They include bleeding, sometimes requiring transfusion, infection, injury to surrounding organs like the colon or lung, and potential scarring in the kidney.
Okay. Is there still ever a need for traditional open surgery, like a big cut?
Thankfully, it's very rare nowadays. Open surgery is usually reserved only for the most complex cases, maybe extremely large stones, abnormal kidney anatomy, or when other methods have failed or aren't feasible.
What does that involve?
It involves a larger incision in the side to directly access the kidney and remove the stone. It means a longer hospital stay, maybe around 6 days, and a much longer recovery, typically 4 to 6 weeks. The risks are also higher, including significant bleeding, infection, hernia at the incision site, and organ damage. Plus, more noticeable scarring.
So really a last resort.
Pretty much, yeah. The minimally invasive techniques have really revolutionized stone treatment.
After any of these procedures, what's the general post-op care like? What should someone expect?
Well, pain management is key initially, so taking prescribed pain meds. Antibiotics are often given to prevent infection.
And drinking water, still important.
Absolutely crucial. Drinking lots of water helps flush out any remaining small fragments or blood clots. Again, aim for that pale yellow urine.
Okay. What about blood in the urine?
Seeing some pink or light red urine for a few days after most procedures is normal. But if it's heavy, like ketchup, or getting worse, you need to call the doctor right away.
And straining urine.
Yes, your doctor will likely ask you to strain your urine for a period after surgery. Catching any past fragments is really important for that stone analysis we talked about to guide future prevention.
Got it. And rest.
Definitely need adequate rest. Your doctor will tell you when you can return to work and normal activities depending on the procedure and how you're recovering. Usually avoid heavy lifting for a while.
Okay. So, after going through all that, diagnosis, maybe surgery, what's the likelihood of getting another stone? Is recurrence common?
Unfortunately, yes, recurrence is quite common. If you've had one stone, your risk of getting another is significantly higher.
How much higher?
Studies show there's about a 35% to 50% chance of forming another stone within 5 to 7 years.
Wow, up to 50-50 within just a few years.
Yeah, it really underscores why long-term prevention is so important after you've had a stone.
And the risk factors for recurrence are similar to getting the first one.
Pretty much, yes. Younger age when you had the first one, family history, being male, Caucasian, overweight, having high blood pressure, certain medical conditions or medications, those all increase the risk of getting more stones.
So long-term prevention really comes back to?
Comes back to those fundamentals. Consistent, high fluid intake, making those tailored dietary changes based on your specific stone analysis, that's key. Promptly treating any UTIs. Managing underlying conditions like gout or hyperparathyroidism. It's an ongoing commitment.
It really is. We've covered so much ground today. From, what these things even are, the different types.
The symptoms, the causes.
Right. All the risk factors, the lifestyle links, those odds ratios were eye-opening.
They really were.
And then diving into prevention, hydration, diet, managing oxalate and calcium correctly, and being cautious about home remedies.
Definitely. And then the medical side diagnosis, the different treatments from shock waves to scopes to surgery when needed.
It's a lot to take in, but what really stands out to you from all this?
I think what stands out is that dual message. Yes, kidney stones can be incredibly painful and serious if ignored, but also there's so much potential for prevention and management. Knowing your risk, knowing your stone type if you've had one, it really empowers you.
It does. It feels like knowledge is power here. But here's maybe a final thought for our listeners to chew on. We talked about prevalence rising, even in kids now, potentially linked to diets high in salt and high fructose corn syrup.
Right, that's a worrying trend.
So, thinking bigger picture, what kind of societal changes, maybe in food policy or education, might we need to think about to help turn that trend around, to promote kidney health right from a young age? Something to mull over.
That's a really important question. And just to wrap up, while we've shared a lot of information, remember this is general guidance. It's not personal medical advice.
Absolutely.
Always consult your own doctor or a registered dietitian. They can look at your specific situation, your health history, your stone type, and give you personalized advice for diagnosis, treatment, and that crucial prevention plan. They'll know if these strategies are right for you or if they might cause other issues.
Couldn't agree more. Professional guidance is key.